Hello, my name is Bahar Alabneja. I'm third semester student of practical nursing. My student ID is 101237475. And this is my assignment number 1 about IV medication, reconstitution, and administration. My case study is case study number 1. First of all, I want to explain the calculation. After that, I'm gonna take a video about the practical part. So according to my case study, Mr. Singh has GI bleeding, and the medication is pantoprazole, which needs to be given 30 milligram IV over 50 ml of solution in 20 minutes. According to the label on the medication, if we add 10 ml of the water to the whole vial of the 40 ml of the pantoprazole, we're gonna have 4 milligram per ml of pantoprazole. So first of all, I'm gonna write the formula, the volume that I need to remove from the reconstituted med. Reconstituted means the amount of the powder which we added water to that, and we have a special reconstitution, a special volume. So I'm going to divide 30 milligram, the dose ordered, divided by dose on hand, which is 4 milligram per ml, and the result is 7.5 milliliter. It means that I have to get 7.5 milliliter of medication and add it to my mini bag. For the if we don't have any pump, I have to calculate the drip factor. According to the IV pack, the drop factor is 10 GTT per ml. So drip factor formula is volume multiple to drop factor divided by time in minutes. So the total volume is 50 ml multiplied to 10 divided by time, which is 20 minutes. The answer is going to be 25 GTT per minute. It means that the IV should be 25, it should be administered 25 drops in 1 minute. If we have a pump, we need to calculate the flow rate. Flow rate is the amount, the volume divided by time, but the time should be an hour. So the volume is 50, the time is 20 minutes, and we're going to divide it to 60 to change it to hour. The final answer should be 150 ml per hour. We have to insert this amount in the pump. For the pantoprazole, which is a pump inhibitor, first of all, each med has 10 right that we should consider it. So for the first check, I need to check the medication name. For example, that one is pantoprazole, and check it with my MAR to be sure that the medication is right. The dosage, I have to check with my MAR. The prescription is 30 ml is correct. So the route is IV. Again, check it with my MAR, which is IV. And the patient's name, first name, last name, and date of birth, everything should be correct on my MAR. That one is the first check. The second check should be in patient's room. I'm gonna knock the door, enter the room. Hello, may I have your first name, last name, and date of birth? The patient say, for example, first name, Mr. I don't know the first name, but Singh, date of birth, blah blah blah. And I have to check the bandage and be sure that it's a patient, it's a correct patient. Again, in front of the patient, I'm gonna check the medications. Yes, the medication is correct. The dosage, again, check it, 30 ml. The route is IV. The time, for example, is what time it should administer. Now is 2300, so the med should be administered now. And I know the reason for the med, but that this med is a pump inhibitor, and it helps my patient who is Mr. Singh, who has the GI bleeding. It helps to decrease the acid in his GI system. So I'm gonna explain the med for my patient, Mr. Singh. You have a new med. It's pantoprazole. It's gonna be through the IV. This med is gonna decrease the acid of your your GI system, and if you may have some adverse impact. You may see that your stool is dark, or you feel nausea. But if you see any abnormal side effect like vomiting, like lung GI bleeding, such as dark stool or any rashes, any abnormal side effect, please let me know. Would you like to take the med? And if my patient accepted, that's fine. If not, if he refuses it, he has the right to refuse it. I have to document whatever happened between me and patient correctly, and I have to say that I have to come back after certain time to be sure that what the response of the medications, and the patient is fine or not, and I educate and document whatever happened. And as I said earlier, the patient needs to be educated about the med completely and know everything. So after this part, I'm going to do the practical part. Thank you. Okay, this is the practical part of my assignment. First of all, I didn't have the Estril, the needle, the blunt, and the syringe. So we assume that they are all new, and also my mini pack. First of all, I'm gonna sanitize my hand. We assume that this area is also clean because we should follow the aseptic technique. So I'm gonna let it get dry. Okay. Perfect. I need to open this lid. We assume that this one, the powder, is the pantoprazole IV. Easily open it. Again, open it. Estril the top part. We want to be sure that it's completely clean. I don't have extra pad, so I will also clean this part, the port. Now, so for opening this, it should be a banana peeling technique. Also for that, perfect. I have to add 10 ml of this, my water, still water, to my powder. So I will add to 10 ml of the air to this to make a negative pressure. In this way, it's gonna be much easier. We don't want air, so I empty the air. Okay, perfect. And it should be, it has a couple air that I try to empty. Perfect. See, 10 ml. So I will add this 10 to my powder. As you see, it was completely add because of negative pressure. Okay. Now I have to get 7.5 of that and add it to my piggyback. So I will take 7.5. Be sure that there is no residue. It's completely dissolved. A little more. Okay, it should be from the area that it's not, the air is not inside that. Okay, we need a little more. Perfect. Because of the negative pressure, it may spray a little. We try not. Okay. It should be 7.5. 7.5. And I still the top part. I have to add this to my piggyback.